The parents of a 7-year-old boy who weighed more than 200 pounds face murder, child abuse, and torture charges.
That news story is just heartbreaking. Hi, I'm Dr. Terry Ann Scott. I'm a health coach and personal trainer with TAT Health Solutions. When I first saw this story, I started immediately thinking about a bigger question. Like, how could this tragedy have been prevented? So I shared the story with one of our maintenance classes where Coach Timmy, our nutritionist, our participants, and myself, we had an honest discussion about childhood obesity, family health, and the role prevention can play in changing our lives. So let's watch the rest of this news story, and then I'll bring you into our class discussion.
This story began to unfold on November 4th when a 911 call was made for a young boy in distress at a Flint Township home. He was rushed to a hospital, but he died. And Terry, the Genesee County prosecutor says this is just a terrible case of neglect.
Yeah, he does, Angie, and that's why his office has charged the parents with second-degree murder following the death of their 7-year-old Casper, their son. He was 50 inches tall and weighed 255 pounds when he died.
On the face of it, this is cruel and extreme suffering from this child caused by the neglect of the parents.
40-year-old Damian O'Brien and his wife, 41-year-old Jessica O'Brien, face the same charges in connection with the death of their 7-year-old son Casper. The most serious charge, second-degree murder. Flint Township Police came to this home on Dania on November 4th, 2025, for a report of a child in distress. Casper was taken to Hurley Medical Center, where he died a short time later. Medical reports indicate he weighed 255 pounds at the time of his death.
That's obesity. And then you also have the fact that this child did not have a pediatrician, was only taken to the doctor, I believe, according to the police reports, once.
The cause of death was dilated cardiomyopathy, which causes heart failure, with a contributing cause being morbid obesity. The CDC lists a healthy weight for a 7-year-old boy that is 50.5 inches tall, generally ranges between 50 and 73 pounds.
The dad has a good job. They have real health insurance. That morning that the child died, they had even called their veterinarian to have their dog treated.
The O'Briens also have a 5-year-old daughter.
None of these kids even existed in the eyes of the government. CPS had never been out there. Nobody knew about these kids. They'd not been to school.
Genesee County Prosecutor David Layton says on the day police were at the home in November, the owner of the house stopped by, concerned, believing the house was falling into disrepair and the couple wasn't letting him in the house, instead leaving the rent on the porch.
I can't think of what else this is other than extraordinary, terrible neglect. And to me, that's willful and wanton misconduct, which is second-degree murder.
And police described the living conditions in the home as a hoarding situation. Now, I could not reach the O'Brien's attorney for comment. They are being held at the Genesee County Jail on no bond.
All right, so we're gonna talk about a couple of things with this, right? So childhood obesity. Now, I guess I wanted to questions because when I saw that, it blew my mind, and I had a couple of questions too. But a couple of questions for you guys. What thoughts or emotions came to mind after watching this story? When you saw this story, what thoughts and reactions came to your mind?
How can a parent do that to a child?
Okay. How can a parent do that to a child? Okay.
Yes. Overfeeding them. Just letting them have anything.
Okay. I guess one of the questions I had too is, do you think that the parents should be charged for the murder of this child being so, let's say, obese and dying from this heart condition?
Yes.
Yeah,
Yes.
they're obviously negligent in that they had not taken to a doctor, and who knows what went on in their home and why the child ate so much, and
Right.
how he was able to get to those things that made him so obese.
Mm-hmm.
Yeah, I saw a story as well, like a couple of weeks ago, actually, or days ago. And I mean, for me as a dietitian, first thing that came to my mind is I wanted to know, what do the parents themselves weigh? Like, what is their own health condition? Because it's just like tonight's class when I said, when you read food labels, involve your family as well. Let them know this is why we're eating what we're eating. So for me, it's kind of like a tree, and they are kind of the roots cause. They, as the parents, like you said, how is the child even getting access to these things? Is because that's what they have in the house. And when you look at them, even they are probably way more unhealthy than you can think about. And one of the things we also said today was the fact that many people don't even know they have kidney disease and things like that, or even heart disease or heart failure, until they get to the point that they begin to be symptomatic. So there's a question of, how did the boy get to that position? And then there's also that, the parents themselves, what are they doing, what are they eating? Because that will tell a lot. And that's why one of the things we always say is involve family. Let everybody know why you're making decisions you're making, because at the end of the day, health is not just for you, it's for everybody. And when you make one healthy decision, it's it has a ripple effect, especially on your immediate family. So that's what I thought about first when I saw the story. It's sad, but I mean, unfortunately, that's the reality they have to live with now.
Mhm.
Okay. Thanks, Coach Timmy. That is good to know. I mean, you've been a nutritionist, so yes, I think you said some key issues.
Right.
All right. Anybody else on that? Where I'm getting.
Well, the other issue is that society now seems to control. I mean, I just see overweight kids everywhere. And when I was growing up, way back in the 50s and 40s, you just didn't see fat kids. But now you do. So there's some society impacts in there as well. The fact of TV advertising, peer pressure, and just availability of a lot of the foods we talked about today on the session, the high sugar, high sodium, so easily available. So it's not a simple issue.
Right.
Yeah.
I love it. Great answers. I totally agree with everybody. I have mixed situations, emotions about this. Should the parents go to jail 50-50? Definitely for the hoarding and they haven't taken the child to doctor. But parents, they do have a major responsibility, because when you look at this child's weight at 250 pounds, the children don't buy the food, they don't cook the meals. So they don't really do too much. So that is the parents' responsibility. So healthy habits always, usually begin at home. And then like Richard was saying, 30, 40 years ago, we didn't have ultra processed foods. The kids were not overweight. And children spend more time outside playing. And so nowadays it's totally different. And then when it comes to obesity, it's more complicated than just eat less, right? We know genetics, sleep, stress, medications, mental health, food, environment. But the biggest problem I had was if we're going to start charging people for obese kids, and I foresee some more of these incidents happening, that's going to be really strange, with 70% of Americans being overweight and obese, and their children are 2 to 3 times more likely to be obese. So that is going to be interesting.
Exactly. And I agree. And that's something I thought about. So I'm like, this is going to be a very interesting. I mean, it will be interesting to see how it unfolds. But then I think on the grand scheme of things, it's not just because of the fact that he was that weight or he was, overweight that they're charging them. It's more so kind of like, and it's a whole lot of things combined together. Because if it was just by the weight, hey, a lot of parents are going to be in a big trouble, because I mean, science is showing, like you said, 70% of people are overweight now, and science is showing that if you are having a child when you yourself are overweight, the child already has 2 to 3 times more, likelihood of being obese themselves. So yeah.
Unfortunately, it starts at home. And if the parents are overweight, I don't know what we can really expect from this, of the child passing away. But we have to, and that's why programs like this is so important, because as you saw 2 weeks ago, we presented Corrine and her son. Imagine if these parents were like Corrine, where you're in the gym with your child. Her son lost 15 pounds because she was in this program, right? So, and she started cooking healthier, which then affected him because she was cooking. And she started going to the gym more, and he wanted to go to the gym more. And it's the opposite as well for unhealthy. Can go the same way. Parents sit at home, watch TV, eat junk food. Then the kids are more likely to sit at home, watch TV, and eat junk food. So, like Coach Stevie said, that's a big one. There's going to be a lot more cases like this. I don't know, but at the end of the day, the child is the real victim, because he did not choose, he did not know any better, and he thought or believed his parents truly loved him, which they probably did. And maybe, again, as we see in this program, we came in here with very limited knowledge of nutrition and physical activity. And imagine what the average American has who does not complete this program, and they're raising kids like this, right? So this conversation can go on and on and on. But we're going to get ready, and I'm going to let you guys get out of here. And then I gave you my perspective is that schools, community, healthcare, home, everybody needs to be involved early. Healthy habits are learned at home. Small daily choices compound over time. Food is only one part of the equation, right? It's a whole bunch of things. So remember, every healthy choice matters. Every walk matters. Movement is medicine, as we talked about. Every step is progress. Every family conversation matters, as we saw with Coach Mary, where she was in a program, her husband was in a program, her sister was in a program, and we let our loved one, my family was in a program, and we continue, whether we're modeling our lives, we're letting our friends and family become healthier, because that's how we're going to chip away of this obesity problem that continues to get more and more out of control as well. All right, and that's all I have, guys. Thank you. I know we went a lot over time, but I did want to share with you guys that article. I thought it was worthy sharing. Since we're going to see more of this, and we need to know what we're dealing with. All right, so I'm not going to hold you guys up. I know we've been here long enough. You guys have a great 4th of July. And
happy birthday.
Great
too. Happy
evening.
birthday.
Happy birthday. Bye,
Happy
everybody.
birthday with
See you
my
in 2
daughter.
weeks.
Thank you. Happy birthday.
Happy birthday to Coach Makita as well. Bye.
Yes, thank you.
bye.
Bye.